Let's bring in Dr. Ashish Jha, the Dean of Brown University School of Public Health. Dr. Jha, good morning to you. It's a big, big day. I think a lot of parents have been waiting for this day. But put it in context for us. What does this mean in terms of breaking the back of the pandemic?
Yeah, so good morning, Hoda. Thanks for having me back. It is a big day, and as a dad of a 9-year-old, it's a really big day because as soon as my pediatrician can squeeze him in, we're going to get our 9-year-old vaccinated. I think it's great for kids. It offers that protection that we've been waiting for. It also means that every school-age kid in America is now going to be eligible for a vaccine. That really has a profound effect on schools. And I think it means that all schools, again, should be open and full-time, but that we're going to have fewer quarantines, so that schools are just going to get back to a much more normal that we've all been waiting for. I think this is really important.
Well, Dr. Jha, you just said your 9-year-old, you'll take him right away to get his vaccine, but only 27% of parents polled in the country are with you on that. Another 30%, they're kind of on the fence. They're going to wait and see. There's another third that is saying no way. So what would be your message to those other parents?
Yeah, so what I would say is, first of all, talk to your pediatrician about this, because at the end of the day, you want to get advice from people who take care of your kids. America's pediatricians have come out very strongly in support of this. The risk from COVID is so much greater than any risk from the vaccine. And given that this virus is going to be around for a long time, it's really important that we do this to protect kids. You know, we have lots of vaccines to protect kids. This is the most studied vaccine we have. It's really important that kids get it.
Tom pointed out one of the risks is the risk of heart inflammation, myocarditis. Is that a valid concern that parents should have?
Yeah, absolutely. Myocarditis in vaccinated older boys, young men, does happen. We haven't seen it in 5 to 11-year-olds. It's incredibly rare, and thankfully, every case we've seen has resolved and people have gotten better. There's also myocarditis that comes from the infection itself that's much more dangerous. So again, if you're comparing the vaccine to COVID, the vaccines are much safer.
Can we talk just dosage for a second? Because now, again, these are for kids who are 5 to 11. My child's going to be 5 in a little while. She probably weighs about 40 pounds. I know 11-year-olds who can weigh over 100 pounds. So, but is there just one specific dose? And can your child get too much of the vaccine?
Yeah, it's a really good question, Hoda. You know, the clinical trials have shown that the benefit and the side effects to 5 and 11-year-olds are actually comparable, even though they can be pretty different in sizes. What I would say is if you have a particularly small, 12-year-old or a particularly large 11-year-old, talk to your pediatrician about this. The recommendations are staying with the age group, but you can always have that conversation with your doctor and sort out what's the best path for you.
And just super quick, kids ages 2 to 5, when do you expect them to get their vaccines?
Yeah, probably a couple of months away. I think we'll just see when the data comes in. In all of this, we wanted to be driven by data. My guess is we're still a little bit away from that evidence.
All right, Dr. Jha, thank you so much for joining us this morning. We appreciate it.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.